The Ministry of Health says they will be forced to take action if people who have recently returned from China don't self-isolate in response to the coronavirus outbreak. Around 4,000 people have not been registered to the newly created Healthline to say they are self-isolating. And Healthline says they're using information shared by Customs to contact those who are still outstanding. Harry Locke reports.
6,369 people have been processed manually through airline borders since February 3rd, when the travel restrictions came into action. It was enforced to help protect New Zealand against coronavirus, which has now been named COVID-19. So far, just under 2,000 have called the Healthline to register, saying they are self-isolating. The Ministry of Health has since entered into an agreement with Customs passing over personal information. The Ministry's Director General of Health, Dr. Ashley Bloomfield, says the approach is to target those who have not yet registered.
For people who haven't either taken up the opportunity or had the opportunity yet to self-register, that's exactly why we are now using the data collected at the border since the 3rd of February to proactively contact those people and get them on that register.
The Healthline was set up last Friday to be used to register those who have recently arrived from China, and they will begin calling up all those who have not registered from today. The head of the National Telehealth Service, which operates Healthline, Andrew Slater, says they have begun making calls.
We're starting contacting those people today, and we anticipate we should be able to work through that list within the next 48 hours.
Mr. Slater says they are also monitoring people who may be distressed or with particular welfare needs and calling them daily. He says to help with the effort, they've taken on extra staff.
Within the National Telehealth Service, we have over 450 staff that we're able to flex up and things. We're also reaching into some of our partner organisations to bring in some additional capacity, particularly those that speak Mandarin, to be able to connect with people.
Healthline are using information acquired from Customs, who have entered into a memorandum of understanding with the Ministry of Health. Border Operations Manager Terry Brown says it's information regarding their flight booking, identification details, as well as a contact number. He says the information is all being transferred securely.
It's shared electronically. That's exclusively Ministry of Health, and that's why we've entered into a memorandum of understanding to maintain the security. But clearly that information is required for a reasonably extraordinary purpose.
On the phone, Healthline will be asking the people to self-isolate. Dr. Bloomfield says if people don't want to do so, the ministry may have to intervene.
There are powers under the Health Act to require people to self-isolate. If people are not taking the opportunity and the advice and the expectation they will self-isolate, then we would be asking who those people were from Healthline and following them up and seeing if we needed to take any further action.
3 labs across New Zealand have taken on the job of testing suspicious samples for COVID-19 in Wellington, Auckland and Christchurch. Dr. Bloomfield says so far 50 samples have been tested and all will return negative. For Checkpoint, Harry Locke.